I literally studied for the National Written Board, which is the biggest exam, for about a week. Maybe a week and a half, potentially, but a week at the max, for the most part. And I'm embarrassed to say that because I know I should have studied a lot more. What's up, guys? So I know I haven't been on here for a while and I truly apologize about that, but I am back, and in this video we are going to be talking about board exams. So I know a lot of people are going to be taking boards soon, if not within the next year or two, so I wanted to make this video to kind of help share my experience with it and hopefully give you some helpful tips with taking boards. So if you guys have already been following me on social media, then you guys know that I passed all of my board exams on the first try, and I am a registered dental hygienist. So I'm super excited about that, but let's jump right into this video. So what I'm going to be talking about in this video is the board exams I took, the order I took the board exams, what study materials and resources I used to study for each board, including the prices of each study materials, that way you can get an idea, and then also what tips I have for you guys taking boards. So I got my little notebook here, so if you see me looking down, I'm really just trying to make sure that I don't miss anything with this video for you. And yeah, what board exams I took. So I took 5 board exams. I took the local anesthesia board, the nitrous oxide board, the written clinical board, which is the NDHVE board, and then I also took the clinical board and the CSCE, which is the computer simulated board. The order I took these board exams, I took the CSCE June 11th, I took the local anesthesia June 12th, I took the nitrous oxide June 17th, I took the National Written Board August 3rd, and then I took my clinical board September 26th. So those first 3 exams, I took them within like the same week, if not within the next week. So you can imagine probably studying for those. What resources I used for each exam. So beginning with the CSCE, which is the computer simulated, I used the student RDH, which was $69. And then I also used the dental teas, which is $35. Both of these resources I think were really good for the computer simulated. I feel like majority of the stuff that I seen on the study review was actually on the board exam. So I think that these two are really good sources to use for this examination. For local anesthesia, so I used the student RDH, which was $69. And I also used my local anesthesia book that I received in hygiene school. I just studied the questions in the back of the book and kind of went through reading some of the chapters in there. And then I also used other people's random Quizlets. For nitrous, I used the nitrous book that I got in hygiene school, and then I also used some different random Quizlets that I found. I didn't use too many resources for nitrous. Nitrous is actually probably the easiest exam that I took out of all 4 of them, so I think you'll be fine with just these resources. My clinical board, I was already practicing. Thankfully, given the order that they made in Michigan due to COVID, we were allowed to practice for I think 6 months while we were taking our board exam. So I actually had clinical practice on real patients at the office I worked at before I took my clinical board. So I think that worked out pretty well. And not last but least, my national written board, the NDHVE. So for this board, I used Andy RDH. We bought that as a class earlier this year. They also had a board review at the time. I actually couldn't afford to go to the board review. So I just ended up buying the board book that they had, and then which was $300. So that was not including the actual going to the board review over the weekend. So I just used the book to study. I used some of the free resources on student RDH, so I think there's like medical conditions, and then I think pharmacology was also free on there. So I used those free resources on student RDH, but I did not buy the national board because I had already bought the ND RDH and that was already expensive, so I didn't buy that. Then I also used some different Quizlets that I found, and I also used a HESI exam. I don't know if you guys have heard about that before, but they have dental hygiene board exams and practice quizzes. So I bought the practice quizzes, and we also had a mock board that we did at our school. And altogether for the HESI was about $87. So altogether, I spent about $560 on study material. So yeah, it gets expensive, y'all, okay? Now I'm gonna rate each board review from 0 to 10, and I'm gonna list some pros and cons of each one. All right, student RDH at 10 out of 10. I really love the memory technique. I think that was one of the greatest factors about this board review that a lot of other board reviews don't have. Helps you memorize and also connect with the material, so it makes it a lot easier for you to understand. There was also videos explaining. Claire did a really good job with that. And then also the mock exams and quizzes. And it was also really straight to the point. That's also another thing I really liked about this review. 10 out of 10 recommend. Next up is Andy RDH, which is the Dental Hygiene Academy, and I rate this a 7 out of 10. The book had a lot of material in it, which could be a pro and a con. It is very detailed, but I feel like it could be a little bit harder to obtain and grasp all the material in the book. It had an app, which means you can study on the go, which is really nice. The only thing about it is that some of the questions did not have explanations if you got it wrong, and then some of the quality of the pictures on the app weren't great. But I really liked the mock exams and the quizzes. The only other bigger downfall is that it was kind of in a boring format. So it was kind of like there was no pictures, there was no color. So for me, I like something exciting, and this really just didn't fit it for me. But I think it's also a decent source to use for studying for boards. Next up is the Dental Tease, and I rated a 7.9 out of 10. I actually rated an 8 out of 10. Reason being is because the material on this board review was pretty similar to actual boards, which I really liked, and it was also the cheapest board review I bought. I think it was only $35, and I think it gave you a pretty decent amount of content. It was in an order format. It was in a PowerPoint. The picture quality wasn't super great, but the content was still the same. It had no app and no mock exam, and it had a few quiz questions. I just wish they had a little bit more, but overall, I think this is a pretty good review to use. Next up is the Dental Hygiene HESI, and I rate this a 7 out of 10. What I really liked about this board review is that it had the in-person mock exam. It really gave you that experience of actually taking boards. It was timed, and you got to review the questions that you got wrong, so I really liked it about that. I do believe that this review had more difficult questions than boards actually had, so I think this review actually kind of challenged you a little bit when it came to questions. It didn't have an app. It did have pretty thorough question explanation, and it had practice questions. The only thing I really didn't like about the practice questions is I would like to know right away after I answer the question whether I got it wrong or not. And on this one, you have to answer all of them before you can get your score. So other than that, I think it's an okay board review.
Not last but least, just some tips for taking boards. My first tip is to create a study schedule. I literally would study randomly whenever I had time. It was really inconsistent, and it kind of made it hard for me because I would go like days, maybe weeks without even studying, and then come back and forget some stuff and forgot where I left off, and it just made it harder for me. So I think creating a study schedule would be really good for you. Tip number 2, create your own study sets. I think using other people's study sets is great, especially from the board reviews and things like that, but I think creating your own study set and making questions on your own, writing them out helps you remember them, also helps you study better because you're not just memorizing what you're seeing on these different study sets, you're actually writing them out and make sure you're understanding them. 3, minimize your study tools. I feel like people think that the more study tools that you buy, the more you'll be prepared. That's not always the case, and sometimes it really just ends up resulting in spending more money than you have to. I think find the best resources when it comes to studying and stick with maybe like those 2 or 3. 4, don't schedule your exam unless you feel like you're ready. And I feel like you're never gonna feel like you're ready, but if you feel uncertain, I would push it back or just wait, okay? I just feel like you gotta be prepared when studying for these exams. I'm gonna tell you guys a little secret that I really don't even want to admit. When it came to me studying for boards, I literally studied for the National Written Board, which is the biggest exam, for about a week. Maybe a week and a half, potentially, but a week at the max, for the most part. And I'm embarrassed to say that because I know I should have studied a lot more. Of course I passed, but would I have done that again in the past? No, and I don't recommend anybody do that. I think that studying more than a week would help you and benefit you more when studying boards, and it'll also make you feel more prepared. It'll also help with anxiety because you don't feel like you missed some things or things like that. So I recommend studying more than a week for the national boards, okay? My very, very last tip for you is do not give up.
I think that even if you don't pass boards on the first time, that does not mean the career is not for you. That does not mean your life is over. That does not mean you're done. You spent 2 to 3 years getting this degree. You better retake that exam, okay? I think that sometimes it just comes to test taking skills and not necessarily related to your actual knowledge and ability to apply the information, but it's really just test taking. Sometimes you're just nervous, sometimes you're anxious, sometimes you just don't understand the question. So I think that practicing test taking and things like that will help you the most when it comes to taking boards. So I hope this video was helpful for you. I really tried to keep it short so that way, you know, I'm not boring you with all this information, but I really hope that this is helpful with you guys taking boards in the future. And please update me if you guys do take boards or have any questions about board reviews or taking boards or exams or things like that. I'm here to answer any of your questions that you have. I am super supportive of everyone going into dental hygiene. I think it's a great career. So yeah, you can always hit me up on my social media at ToothBay, and then you can also hit me up here on YouTube and I will get back to you. But I hope this video was helpful, and yeah, I'll see you guys next time.